quite a volatile week in the world of general practice, with an argument between the BMA and the Health and Social Care Secretary, Wes Streeting, really coming to a head. This has particularly focused on online consultations and a new contractual requirement that came into force this week. Wes Streeting actually brought it up in his speech at the Labour Party conference in Liverpool earlier this week, didn't he?
Well, as I mentioned, the government has said it's not backing down. But I think the way it's approached this whole situation has been inflammatory. It hasn't given the impression of looking to find common ground with the BMA GP committee, or of trying to come to an amicable solution by providing the kind of safeguards that the BMA wants. Wes Streeting in particular has used some really combative language and hasn't given the impression that he's listening to what GPs have got to say, or that he's taking concerns raised by the BMA seriously. So what he said in his conference speech was that booking appointments with GPs should be as easy as booking a takeaway or a taxi, which maybe isn't the fairest of comparisons for all kinds of reasons, but it's basically setting up this narrative that NHS access should be as easy as any interaction consumers have with any other service. And it's casting Wes Streeting as the champion of that, the guy who just wants the best for patients. And the other part of that narrative is that GPs who aren't happy with this change to online access because of the workload and safety concerns, he's sort of suggesting that's not really the motivation. The motivation is just that they're resistant to change. And he accused GPs and the BMA, anyone who's raised concerns over these changes really, of being forces of conservatism who just want to turn the NHS into a museum of 20th century healthcare. And this isn't the first time he's spoken about GPs in this way either. Only a couple of weeks earlier, he said at a BMA conference that GPs who weren't enthusiastic about having online consultation systems on all day were naive, that they were laggards who needed to get with the 21st century was the phrase he used. And another part of Wes Streeting's approach in his conference speech was effectively to suggest that GPs are being ungrateful. He pointed to funding the government's put into general practice in this year's contract, the recruitment of GPs through the additional roles reimbursement scheme. We've given you more money and more doctors. How dare you not be compliant now? So there's been a lot of quite aggressive, arguably threatening language, and nothing really to suggest the government's listening to GPs.